Top 10 bizarre cures doctors used in the 1800s. The 1800s was a period of great scientific exploration, but medical knowledge was still limited, leading doctors to try various unconventional and often bizarre treatments. Here are 10 peculiar cures that doctors recommended during the 19th century, many of which were ineffective, and some even dangerous by today's standards. 1. Bloodletting. Bloodletting, often performed with leeches or by cutting veins, was believed to cure illnesses by balancing the body's humors. Physicians thought that draining blood would remove bad blood and restore health. Although bloodletting was commonly used, it often weakened patients and could lead to severe blood loss. 2. Mercury treatments. Doctors in the 1800s prescribed mercury for various ailments, including syphilis and constipation. Mercury, however, is highly toxic, leading to symptoms like tremors, memory loss, and even organ failure. Unfortunately, many patients suffered mercury poisoning from this cure. 3. Arsenic consumption. Arsenic pills and tonics were commonly prescribed as a cure for various skin conditions and even as a tonic for general health. Although now known to be a deadly poison, arsenic was widely available and often sold over the counter, resulting in accidental poisoning and death for many. 4. Lobotomy. While more commonly associated with the early 20th century, the practice of lobotomies began in the 1800s as a treatment for mental illness. Surgeons would damage parts of the brain in the hope of curing mental disorders. This procedure was highly controversial, often leading to cognitive and personality changes. 5. Opium and morphine for children. Opium and morphine were used liberally as painkillers, often prescribed to children to soothe coughs, colic, or teething pain. Known brands like Mrs. Winslow's soothing syrup contained opiates, often leading to addiction, respiratory issues, and even fatal overdoses in young patients. 6. Radium water. In the late 1800s, radioactive radium was believed to boost energy and treat a variety of ailments. People drank radium-infused water as a cure-all tonic for arthritis, fatigue, and other conditions. Eventually, the harmful effects of radiation were recognized, but not before many suffered from radiation poisoning. 7. Tobacco smoke enemas. Doctors used tobacco smoke enemas, administered through the rectum, to treat drowning victims and revive unconscious patients. The smoke was believed to stimulate breathing, but this practice was largely abandoned after it was found ineffective and potentially harmful. 8. Electric shock therapy. In the 19th century, doctors believed electricity could stimulate the body and cure ailments ranging from mental illness to paralysis. Patients were subjected to electric shocks in an attempt to jump-start the body, although this often caused more discomfort than relief. 9. Vinegar and water diets. Prescribed to treat ailments or as a method for weight loss, vinegar and water diets became popular after Lord Byron touted their benefits. Patients would consume vinegar mixed with water, which often led to stomach discomfort, dehydration, and malnutrition. 10. Blistering. Blistering involved applying caustic substances or hot objects to create blisters on the skin. This was believed to draw out toxins and reduce fever. The treatment was highly painful and left patients with open wounds, which often became infected, worsening their condition. These treatments are a reminder of the lengths to which early medical practitioners went, often experimenting without full knowledge of the risks. Today, with advanced knowledge of health and human anatomy, we can appreciate just how far medicine has come.